Hi, good evening, everybody. My name is Venkatraman, and this is the third edition of Hearty Talks, which is organized as part of the Heartbeat Run, which is an initiative of YouTooCanRun to fight cardiac disease. So, the idea of Heartbeat Run, as the initiative is called, is that um, we know that running prevents cardiac disease, but there is nobody who's focusing on doing everything around cardiac disease. And many of you know my own story. I suffered a cardiac incident, and then I was running before. I took up running more seriously after that. I benefited a lot because of running and cardiac disease, and that is why when I then sold my BPO, which had about 3,000, 4,000 employees, I founded a sports management company called You2Can Run. And the idea was that if I can run after a cardiac incident, then you too can run. That is how the name came. You2Can Run today is, we like to call ourselves the one-stop shop for everything in running. We do everything to promote running. We have a registration platform, which is the country's only dedicated registration platform. We do race management of some of the best events in the country. Corporates come to us. The Navy event, for example, is done by us. We have a shop. We have a photo tagging service. A lot of brands work with us to do brand servicing and promote their brand and take their brand to the running community. We do virtual events now, which is all the rage because of the pandemic, and so on and so forth. As part of Heartbeat Run, we also organize a webinar, which is what we are organizing today, which is on the last Tuesday of the month. We do that. And the purpose we do that on the last Tuesday is that the last Tuesday of September is World Heart Day. So we launched a Heartbeat Run on World Heart Day. And we did one in October. Now we are doing one in November. So therefore, this is the third edition. And the idea is to stick to that platform and observe the significance of World Heart Day being on the last Tuesday of the month. We try to cover topics that are of interest to running and cardiac disease and dispel many of the myths. Over the years that I've been involved with running and with cardiac disease, and I've done many, many things around that, I have found that most runners and non-runners have a lot of myths. They do not know much about the entire disease that happens, and these webinars are not designed to be very scientific, academic. They'll be based on very sound knowledge. But the idea is not like a lecture, not like a presentation. Some slides will be pulled up, but basically we like to have a chat that is friendly, and we encourage our viewers to please type in the chat question. Doesn't matter whether you're looking it on Facebook group or on the Facebook page of YouTube Can Run or on the YouTube channel of YouTube Can Run. You can type your chat and we can take it live. We can bring you online if you want, etc. So we can do all that. Today, the topic is exercise and cardiac disease. A lot of people know that exercise is good. It helps you to beat cardiac disease. Motapa kam hone ka hai. 60% of the people who take up running take it up because they want to lose weight. All that is like common sense today. But still, there are many myths, and there are many people who don't know exactly what happens. And then there are certain questions that seem like a dichotomy. So we have got Dr. Kiran Sangani here with us today evening. Welcome to the panel, Dr. Kiran Sangani.
Yeah, thank you, Mr. Venkat. Thank you for
Dr.
inviting me.
Kiran Sangani is, of course, a cardiologist from Bombay, and he has been involved very much with the Asian Heart Institute, the cardiac rehab, which was set up under Dr. Contractor, one of the first full-fledged cardiac rehabs in the country. And after that, he has branched out, and now is the head and founder and co-founder of First Doctor, which is the new brand name for Key Life Care. So Key, for those who are in Bombay, know the Key Spine Rehab, the Key Gym, which is in Euros. So Key Life Care is a cardiac rehab that is independent of any hospital. So the idea is that through a franchise model, cardiac rehab, which is very important if you have a cardiac incident and you don't have a cardiac rehab program as part of the rehab program, your life quality of life will never be the same. Okay, you will always feel weak, and you will never be as good as you can be. So the idea is that cardiac rehab will give you the quality of life that you should have. Like I run marathons, for example. I have a training group called Zippers Club where we train people to run half marathons. About 18, 19 people, trainees of mine are there. So they all enjoy a very good life. I mean, cardiac history or cardiac surgery is something that happened sometime in the past. It doesn't have to affect you in the future. So that is what key life care topics that independent is. He is also on the panel of ACSM, conducts classes. Many of you have undergone training in ACSM courses under Exercise Science Academy, with whom we work closely. You must have seen him. He takes lots of lectures. He is one of the most. I asked two people, exercise and cardiac disease. Whom should I take, and whom do you recommend? And both of them said Dr. Kiran Sangani. So welcome to the panel, Dr. Kiran Sangan.
Thank you, Mr. Venkat.
Thanks for taking the time, and thank you for spending this with us. And I know that you also train many cardiac patients to do half marathons and all that. And right now, of course, because of the pandemic, things are closed. So is the gym running? Are you doing remote, or how is it working now?
So obviously, as of now, because of the guidelines issued by the central and the state government to start with, we had our center closed right since the lockdown from 15th of March. Uh, However, since I think 24th October or something, that's when the state government allowed the gyms in Mumbai to start. But however, our founder members and our chairman and the organizers of First Doctor and Key Life Care still find that it's not really safe for everyone to still come to the gym setup where the chances of crowd can be very high and social distancing can still be a problem. So we still find it's safe and better to wait for a month or so more. Okay, so as of now, we've not really fixed up a date, but we plan to start somewhere in Jan. So obviously 2020 is out of question to start, but we plan to start somewhere in Jan. Although we are in connect with all our patients who are our cardiac rehab patients or cancer rehab patients, whereby we are sending them workouts which they can do on at their home. So I have myself made a workout or home exercise video of myself and shared it with all my patients and clients and they can absolutely replicate the same exercises, which the whole objective is to keep them active, apart from the standard guideline where we would tell them to at least walk for 30 minutes, be it in their compound, be it in their terrace, or obviously if on the roadside if the roads are empty, but obviously not to break any law and order as issued by the state government. But along with that, some amount of resistance training, some amount of flexibility training is also equally important to have a good quality of life. So many of the times people focus only on walking or cardio, but probably that might not be completely enough to have a good quality of life. Because as we age, a lot of these parameters or components of fitness do play a very strong role in the day-to-day activities that we carry out. And unless we really focus on improving them by doing regimental exercises to improve those components, people can have difficulties in carrying out activities where, let's say, they might walk for half an hour, but if I tell them to sit down, many would not be able to. And that's something which we don't realize only unless somewhere you go and if you have to sit down and you are not able to, it can be an embarrassing situation. So why do we come to that situation where we have to compromise on our quality of life? So whether it's climbing 4 floors or lifting a weight, or you have to climb a hill station, or lift or do anything, you should be capable of doing anything and everything, no matter at what age you are, and irrespective of what history of health issue you might have. And that's the whole focus of the cardiac rehab, or rather any rehab program, whether it's cancer rehab or rehab for any metabolic disorders, that we want to make you physically capable and mentally confident of doing anything that you want. Okay? At no point of time you need to have that question in your mind that can I do this or not, or will I
Good.
be able to do this or that
Basically, working on what we call functional fitness.
absolutely.
Yeah.
So that is
So,
something which
so
should be.
coming back, doctor, we know that exercise and rehab is good after whatever has happened. But what role does exercise play in preventing or minimizing the risk of cardiac disease? I mean, we know that, okay. But what is the science? What is the evidence? What does literature say?
So if I can share a few slides.
Oh, that'll be nice.
Yeah, one second. Just give me a moment. Okay, so basically I've just made this 4-5 slides on exercise as an approach for an healthy heart. Okay, so can you get my slide? Are you getting my slide?
Yes, yes, yes.
Okay, so this is a slideshow I've made. All right. Right. So basically, the point is, before we really understand how does exercise help in preventing heart disease or improving your heart, we need to understand what are those risk factors which really leads to heart disease, because that forms the basis of how you can prevent the heart disease and how you can manage your heart, even after suffering from a heart disease. So there are these few risk factors, and I'm sure everyone would have read this somewhere or the other, but it's always good to have a little recap, because these are the things which we tend to forget and we ignore in our daily routine, and somehow these numbers go out of control. So it's very important that we know what those risk factors are. Okay, there are factors which we cannot change, what we call them as non-modifiable risk factors, which is your age, okay, your gender, your ethnicity, if you have a family history of heart disease, or if you have a past history of heart disease, then obviously that risk always remains, which we cannot change. But risk factors which are in your control and which you can definitely change are smoking, okay, high cholesterol levels, high blood pressure, diabetes, obesity, physical inactivity, and that's something which is the topic for today, and certain parameters related to your cholesterols. Now, these are factors which are completely under your control. All right, you decide whether you want them under control or not. And if you can keep them under control, you are reducing your risk of suffering from a heart disease in future. Okay, so primarily when we talk about preventing heart disease, it's about modifying these risk factors if you have any of them. Okay, now many of these risk factors are, frankly speaking, without any cause. Okay, so you might be absolutely healthy, and suddenly when you do a testing, you come to know that you have this high blood sugar. So many of these risk factors would not give you any indicators unless you test yourself for them, especially high BP, sugar, and cholesterol. Smoking, if you're smoking, you can stop. Physical inactivity, you would know. Okay, but the other three factors, which is cholesterol, diabetes, and your blood pressure, is something which you need to get yourself checked for to know whether you have that risk factor or not. Okay, so when we talk of what can I do to really control this risk factors, and if I were to say, if there is one tablet, like nowadays, in this COVID situation, when it started, everyone would have started vitamin C, B complex with zinc, and with that interpretation that if I'm taking these supplements, I would, improve my immunity and my chances of suffering from COVID would reduce, which is correct. But it's not like a foolproof immunity. But because people had that information, practically everyone would be taking now the C and the Z and the B complex. Same thing if I were to say, if there is one medication if which would help you to prevent diabetes, blood pressure, cholesterol, weight, heart disease, would everyone take it or not? I guess yes, they would just rush to the market and try to buy that one medication which can help. So it's very important to know what that medication is. And frankly speaking, I would say the only one medication which can help you is exercise. You need to wear those shoes and get started with your exercise. Okay, so exercise will be that one single medicine which can really help you to bring all those possible lifestyle related risk factors under control. So you need to treat exercise as medicine. Okay, this is the study which shows that people who are physically fit, obviously by doing exercise, and what is the correlation with suffering from death or mortality, what we call it as. So we can see people who are the least fit, okay, the first tall graph or the bar which you can see, their chances of suffering from death is almost 4.5 times as compared to people who are very fit. So definitely we can say that doing regular exercise or being very fit can reduce your chances of death or mortality. But in general, how does it really help? So yes, so this is how the exercise will work as a medicine. It will most importantly reduce your chances of suffering from heart disease or any vascular disease, which is even your brain stroke, which people suffer from. In general, as per guidelines issued by American Heart Association or the ACSM, to remain healthy, we are not talking about becoming fit, to remain healthy, the amount of exercise which is required is very, very small. You don't have to really do exaggerated amounts of exercise. Even as little as 30 minutes of simple brisk walking every day can really keep you very, very healthy. So the exercise, it basically improves your tolerance to any type of effort, okay, any exertion that you take. The exercise helps in better absorption of the sugar by your tissues, so it will reduce your chances of developing diabetes. It helps in dilating our blood vessels. So the more regular you exercise, your blood vessels increase in diameter. And if my blood vessels increase in diameter, means my blood can flow very easily through my vessels. And that is what is the basis of high BP. So if there is no resistance to my blood pressure, I mean to my blood flow, my blood pressure will be under control. So that's how it helps in preventing developing high blood pressure. It also reduces your cholesterol levels. Okay, so it keeps all your lipids, so whether it's your total cholesterol, your triglycerides, even the worst cholesterol, which is LDL cholesterol, even that reduces by doing regular exercise. And there's another type of cholesterol called as HDL cholesterol, which is a high density lipoprotein, which has a protective effect on your heart. Means the higher your HDL cholesterol, it will prevent you from suffering from heart disease. And that HDL cholesterol can increase only by exercise, no other factor. For these other things, you might say for diabetes, I have medicine, for blood pressure, I have medicine, and through food also. But for HDL cholesterol, only exercise can increase that and give you higher protection. Exercise has also been seen to reduce chances of suffering from many types of cancer. So that's a direct correlation that has been developed. And all this is all research based. Okay, there are a lot of evidences, a lot of research articles which are present which show that these all parameters would be reduced or controlled or prevented if I'm doing regular exercise. At the same time, as we age, we know that our bones can become weak, our muscles can become weak. Okay, so even your chances of suffering from many of these musculoskeletal disorders will also reduce if you are doing regular exercise. And in fact, falling down, so as an injury because of a fall and leading to different types of fractures, is also a very high cause of death in the elderly people, which can actually be prevented if I'm regularly exercising. Because my muscles are stronger, my bones are stronger because of exercise, my chances of falls become less. Most importantly, I tell people that even if you don't see any of these factors, your quality of life, okay, is going to be much, much better. Your self perception about yourself, your self esteem, you will always feel good if you're doing regular exercise. You'll feel more energetic. And that is something which we'll see immediately, even after a month of regular exercise. That person will start feeling very, very good. So, in general, this is the way how I would say exercise is going to be very helpful in terms of preventing heart disease, in terms of controlling all the risk factors which can lead to a heart disease. Okay, and the same thing applies even after you suffer a heart disease. Many of the times people who are having some symptoms and they go to a doctor for a checkup, they find that the doctor tells them that you are lucky that you didn't have a heart attack. Why? Because you were exercising, and because of your exercise you have actually developed alternate blood vessels which are supplying. So you actually develop new blood vessels which supply blood to your heart muscle, and that can actually replace your blocked arteries. So the most commonest cause which people suffer from is blockages in those vessels, and those blockages can lead to a heart attack. But some people can be saved from that heart attack because they have developed new blood vessels because of their regular exercise. So a lot of these physiological effects happen inside our body, and these parameters that we see, which are risk factors, will be controlled or prevented by doing regular exercise. Yeah. So I guess that is how exercise will be very important and will be helpful.
Doctor, thank you very much. Uh, Thank you very much. And that really brings out. It is a very, very, very succinct and we don't want to go into all the number crunching and graphs and all that. But that
Correct.
one graph that he showed, 4.5 times,
Ah,
for a sedentary individual and for a fit individual, that
correct.
I think is probably the key takeaway graph of that. If there's
Hmm.
one graph, I mean, all the slides are important, but but
Yeah,
if one is to say which is more important than the other, then
absolutely.
it again and again reiterates that there is no alternative to exercise.
Right.
Even in the present times of COVID, all this talk of immunity and all that is happening. People are saying, "Oh, immunity has to be there," which means you have to be healthy and fit, which means you have to exercise, and of course, eat sensibly. Okay, so that is really what comes out. Now, let's say that and we have got some very good questions coming.
Hmm.
We'll take those questions all together at the end. Definitely, we will
Yeah.
address that question about sudden cardiac death, and that is all being coming there, risk evaluation. Now, let's say there is a sedentary individual and he's gone through COVID and he knows, he's put on a little bit of weight and he knows that, his heart disease factors are, high. Probably he does a cardiac risk evaluation somewhere or the other online program and he wants to now start exercising. Okay, there is always this fear on one side. Oh, if I start running, I'll die. Which is an extreme fear. Okay, and not because the few incidences do happen, but whatever it is. Okay, what precautions should one take? I mean, what should be the path to follow? I mean, sedentary individual coming to you as a cardiologist, you are an exercise physiologist. Okay, you know the best. So, what are the best practices? And in our audience, we also have a lot of trainers. Okay, and many of the trainers do not know exactly how to go about doing it. So in terms of risk stratification, as we call it, how does one go about determining the risk so that the person becomes healthy without taking too much risk? What are the steps and how does one go about?
So basically, health screening becomes the most important factor in terms of determining what your risk level is. So prior to starting any exercise program, especially when we are talking for a sedentary individual who has not exercised since a long time, it's very important to find out his current health status. And here, whether you are a trainer or you are just a fitness enthusiast, it's not really something where you would need a complete medical background checkup of that person, but certain parameters to be analyzed and checked which have got direct correlation to physical activity. Okay, so whereby I would try to screen that client for any history of whether he had any heart related disease in the past. Okay, or is he having any symptoms which are indicators of an underlying heart disease, what we call of an angina symptom. So very commonly people can have symptoms of breathlessness or referred pain in the chest or the shoulder or any of the upper part of the body, especially during exercise, which many of the times clients can be ignoring because it's not directly happening on the chest. Okay, so something like a shoulder pain or a jaw pain, and which we take it as a toothache or a frozen shoulder. Okay, so that is something which we need to investigate, and if at all the client is complaining of any of those symptoms during exercise or physical activity, it's important that he should be referred to a physician for a further evaluation. And there are other health screening questions which can be asked to find out about his musculoskeletal status, about any lung related disease that he's having, or if he's having any of these lifestyle related disorders like diabetes, blood pressure, cholesterol. Okay, so basically, as per guidelines given by AHA and the ACSM, person having or person basically answering yes to any of these questions, it is always safer to refer that person back to the physician and get a medical clearance from the physician whether it is safe for that person to get involved in a vigorous activity or not. Okay, now once you get that clearance from the physician that okay, he can exercise, I have put him under medications and all that, then it is important for us to really test that person for his physical capacity. Okay, because as we said, he's a sedentary individual. Okay, we don't know what he's capable of, so I need to really do his fitness testing, and there is a sequence of assessment as mentioned by ACSM that should be done as a mandatory thing for each and every client prior to starting any exercise program. So I need to test that client for various fitness related components, which is his aerobic fitness, his muscle fitness, his flexibility. So now, depending on the health screening data and the fitness testing data, now I can design a comprehensive exercise program where I'm going to start that person on a low level of duration and intensity of exercise. And depending on his adaptation to those durations and intensities, I will make him progress with the amount of activity that he can do. All right. So obviously, it's very important to really go slow and steady with the exercise. We would say exercise is beneficial for majority of us, but exercise is also physical stress on the body, and if not done correctly or if overdone, it can lead to abnormal physiological responses or even musculoskeletal injuries. So it's very important to really evaluate that person to start with, and then put him onto an exercise program rather than just randomly starting everyone onto a very standardized program, which many a times many trainers can falter to, and try to be little ambitious and push the client little more than what is capable of, and eventually can lead to an injury or an abnormal physiological response. So any doubts as a trainer or as a self exerciser, if you have got any health related issues and if you have the slightest of doubt whether is it safe for me to exercise or not, always go to a physician or to your family doctor or to a cardiologist, get yourself evaluated by him, and then decide how to start with the treatment.
I really like this because um, many of this average doctors themselves don't exercise, and they themselves don't have much knowledge of exercise physiology,
Yeah.
be well on risk stratification guidelines of ACSM. And when somebody who's 40,
Okay.
45, he say,
Okay, you
"अरे
can
क्या
now
जरूरत है?"
consult me. Okay, if I make it simpler.
क्या जरूरत है? And then they make the fellow not to run. And then his family also starts thinking, suddenly at 45, why does he want to run? At 40, why does he want to run? What will happen? This entire negative thing around, starting exercise. And doctors also play their own role in dissuading people who are
Correct, correct.
enthusiastic
Which
from
is
going and
wrong.
running.
As I said in my first initial talk, that I want every person to be physically capable and mentally confident of doing anything that he desires to. Whether
Correct.
it's climbing a hill or running a marathon or lifting a
Mm.
weight, there is no restriction to any activity that you can do even after suffering from a heart problem. It's just
Correct.
that you need proper guidance, you need proper supervision and evaluation to really
Mm.
reach those targets.
Mm. Yeah, I mean, the idea is to contain the risk, identify the risk,
Correct.
determine the risk, and then do within the risk, and then increase the envelope of risk as the training effect, kind of kicks in.
Someone might reach it in 6 months, someone might take 3 years to reach. But
Correct.
so depending on your capacity, we would be able to take you to that level, but it is possible.
Correct. So let's say that there is this question, there is this debate between in runners and people's mind. Should I go and first get myself checked? Okay, and then what check should I do? Or should I just start running? Because if I go and get checked and something comes out, then to sala jo hai wo bhi bigad jayega, kind of situation. Whatever is there will also get spoiled. So I
Correct.
will avoid check. So there is this some people want to be very, very cautious and they want to do the checks and then start. And some people don't want to get themselves checked because they feel that something will get revealed and it'll put a stop to their entire life and etc. Okay.
Correct.
Uh, so the question is that under what conditions does one stick with the trainer and start sensibly, or what is the trigger point to go and get tested, and if those trigger points are there, what is the kind of test that one should do before starting exercises?
Okay. So I guess I would say age is the biggest trigger factor.
Mm,
Okay, and age is something which is one of the biggest risk factor which we cannot really counter. All right, and with aging, your risk for suffering from heart disease also increases. So definitely, as per guidelines given, anyone above the age of 45, and
mm,
for males and 55 for females, which is
mm,
considered to be as a risk factor, it is good to get yourself medically evaluated if you plan to start getting involved in a exercise program after that age. Okay, so let's say you've been sedentary all these years and suddenly at the age of 48 you decide I want to. I think everyone is running a marathon nowadays. It's a very into thing nowadays, and even I think I should do it, and you decide let me also try, then obviously you need to first get medically evaluated before you really plan to do anything vigorous. Okay, but someone who has started at a young age, obviously it can go through a fitness trainer, get evaluated by the trainer, and start onto the program. But beyond a certain age, as I said, 45 and 55 for males and females, better to do a medical evaluation, especially an evaluation called as the stress test and the 2D echo. Okay, these are two tests which are the basic investigations which can tell us how our heart is functioning. Okay, it tells us the structure of our heart, the function of our heart, and are there any blockages or is there any restriction of the blood flow to your heart muscle, is what is the information we will get by doing a stress test and a 2D echo. And these are the basic tests which can be done prior to starting an exercise program if you plan to start after a certain high age, which is 45, 50 roughly. Okay, so that is something which I would say can be a trigger point as to when you can get yourself evaluated. Even as runners, even as regular exercisers, the people who are, let's say, already running since the age of 35 and are doing regularly marathons, everything, still beyond a certain age, in spite of your past running experience, I would strongly recommend that once a year you should get yourself evaluated for these heart tests. Okay, once in 2 years, depending on how you are doing. Okay, you should get evaluated for this heart test, even if you are having a good history of running regularly. Because it really gives you an insight about what your current heart condition is. Okay, as opposed to your standard parameters that you always look into, which is your heart rate and your pace of running and all that. Okay, but this really tells us the overall functioning of the heart and the effort tolerance of your heart, by doing a certain testing. And many of the times parameters can be silent. Okay, and they might not give you any warning signs till you really till it reaches to a very severe level. So it's always better to get yourself tested by doing a stress test and a 2D echo. These are two basic tests which I would strongly recommend for anyone beyond the age of 45, 50 to get done regularly once a year or once in 2 years at least.
Good. So yeah, I agree with you. In fact, even in my own training group, Zippers Club, because practically the entire year from March we are not exercised, and we don't. We are also taking a cautious, policy, like you have taken, not to open the gym, etc. We are also trying to be a little bit cautious because high risk, a population. So we have decided to do a 2D stress 2D echo, and because in 1 year, occultation could occur. One never knows how the disease has progressed, and times of high stress for everybody. Enabling factor. So that is what we are intending to do, and that is where we want to do. Okay, we come to the last point before we take the questions. Uh, there are so many deaths, and I must also say here that for the benefit of everybody, that on an average day, 80 people die in Mumbai because of heart attack. This is the BMC ka death statistics. Okay, 80 people die every single day because of a heart attack in Bombay. Okay, those 80 people are doing the normal things of life. They are either cutting vegetables, traveling in a train, driving a car, sitting at home and watching television. Whatever they are doing the normal activities of life, and they die. Occasionally, one of them is running, okay, or exercising, or in a gym, or maybe running a marathon itself is not in a training ground but actually running an event. And then there is this entire fear, and that makes a big story. The other 80 people don't make a story unless it's a film actor or somebody who passes away suddenly. Like Doctor Contractual lectures, there is never a story. BPO executive eating chips and drinking beer at home dies because of heart attack. So that's never a story. So the question is that this leaves an impact in the minds. And many people say, no, I should not start running because running can be dangerous. I mean, it can be fatal. Okay, let me put it that way. So what really happened? I mean, how do you dispel this myth, and how do you ensure that this risk is not going to manifest itself, though that risk is very small?
See, first of all, death is not in our control. Okay, that's the first thing. Okay, so there is no guaranteed thing that we can say that if I do this, I will not die. All right. So this sudden cardiac death, which is like a very big question always, and especially when it happens in events like a marathon, and especially when it happens to a person who has been regularly running, it really raises a big question as to is exercising or is running a safe thing to do or not. So as I said, definitely there are risk factors which leads to a heart disease, and if I can control those risk factors, I'm minimizing my chances or reducing my chances of suffering from a heart disease. But again, still there are so many things which are not in our control. Okay, so our genetics is one big factor which is not in our control. So many of the times people who will have normal BP, no diabetes, no cholesterol, normal weight, exercising regularly, eating healthily, but still suffers a heart attack. Okay. Now that's something which is very difficult to answer and explain to that family as to why it happened. But that's where genetics does play a big role, whereby your genes do matter. And if that has played the role, we can't do. Okay. The one way of looking at it that is that because you are doing so many things and everything was under control, he suffered a heart attack at the age of 60. If he was not doing all that, probably he would have got it at the age of 40 itself. Who knows? Okay, so definitely we need to continue doing the good things, but at the same time, we should not have that false belief in our mind that because I'm exercising or because I'm running, it gives me immunity from developing a heart disease. Many of the times, the running community does have that false belief, okay, that nothing can happen to me. Because I do regularly these 5-6 marathons in a year, I run every day for 1.5 hours. I'm so fit, I mean, I cannot fall sick or I cannot have a heart problem at least. Okay, which is not absolutely correct. Yes, because you are running, your chances of, or because rather I would say the word regularly exercising, your chances of getting a heart problem can be much lesser as compared to the other people who are not exercising. But there are other contributing factors as well, as we saw. Okay, and many of these factors are silent parameters. Many of the times runners have never got themselves evaluated also. Okay, just 4 months back in this COVID season only, one of the running group, I don't know, from Borivali or somewhere, they are a running group who run at National Park. And out of that, 1 or 2 of them had attended our marathon training course in the ACS, and by which they understood what is the cause of death which happens in runners. And because of that, because now they understood the topic, they actually got all of their runners evaluated for a stress test and the 2D echo as per my prescription. And you would not believe, I think 20 of them did that, and at least 5 of them had a positive stress test. Okay, and they were doing regular running.
Just for the sake of the information, positive is not good in this case. Okay.
Correct. Yeah, so it's
People
a
think
little
positive is
wrong.
अच्छा ही होएगा.
Exactly. And those were absolutely normal. I mean, running regularly. It is just in this COVID season, they were not running since last 2 months, and because they planned to start from June or July in their lanes or somewhere like that, they consulted me and I advised them to do this test and the 2D echo. And almost with 5 out of the 20 had a positive test. Okay, and all in the age of 45, 50. So the point is, it's not that because you are running, you are immune to developing a heart disease. Okay, you still need to get yourself evaluated. And at the same time, many of the times, even after these tests are normal, still people suffer a sudden cardiac death at the event. Now, there are a lot of these studies which are done on these deaths as to why these deaths are happening. And one of the commonest factor that has been found in majority of these sudden cardiac death, especially at the end of the run, is that these people are having a hypertrophic cardiomyopathy. They are suffering from a problem called as hypertrophy cardiomyopathy, which is in simple words, your heart has become very thick and enlarged. The capacity or the volume of it is still very small. Okay, so now because this heart has become very thick and enlarged, its pumping capacity reduces. So many of the times, especially at the end of the run, when that person is really exhausted and really trying to finish at his best, somehow that demand and supply does not match. Okay, your body is demanding a lot of blood, but because your heart is having this hypertrophic cardiomyopathy, it is not able to meet that extra demand at a very fast speed, and which leads to an abnormal rhythm in the heart. So majority of these people who are having this sudden cardiac death, they go into this abnormal arrhythmia, what we call it as, or the irregular rhythm of the heart, which is like the almost end stage rhythm, and it leads to that sudden cardiac death because medical treatment is not being given in time, or you don't have the time to give that treatment on the middle of the road, which can happen anywhere, you know. So the commonest cause that people would have is this hypertrophic cardiomyopathy, and they would have this problem right since birth. So it is majority of the time it's a genetic problem. All right, but they would not realize that, they would not have any symptoms related to that, because probably that demand supply mismatch has never happened till that point of time. Okay, so it is very important that if you can get yourself evaluated, you might be able to identify that you are having this hypertrophic cardiomyopathy, and because of that now you probably can follow certain guidelines as given by the cardiologist or an exercise physiologist, that these are your limitations and you should not be crossing those limitations. If you, then you will be in safe criteria, but if you happen to cross those limitations, it can go haywire and it can lead to a sudden cardiac death. So the commonest cause is this hypertrophic cardiomyopathy, which can be diagnosed on a simple 2D echo. Okay, so the bottom line is you just do this stress test and 2D echo, you can find out for yourself whether you are having this cardiomyopathy or not. Okay, second commonest factor is where the person would suffer a sudden heart attack because of the blockages in their blood vessels, and many of the times these the young runners who suffer this sudden cardiac attack or death, the blockages would be very small in those arteries, but they rupture because of some trigger factor. It can be a sudden rise in blood pressure, or a sudden adrenaline rush, you can say. Okay, the blockages can rupture, or the plaques can rupture, which can suddenly increase to a very big size and suddenly stop the blood flow to your heart muscle, and that is what leads to a sudden heart attack, or can eventually again lead to a sudden arrhythmia or an irregular rhythm. So two of the commonest causes which can lead to this sudden cardiac death are this hypertrophic cardiomyopathy, or a sudden heart attack because of an underlying coronary artery disease. Now, many of the times you can identify these problems, but as I said, so hypertrophic cardiomyopathy can be easily identified, which is a major cause, by doing a 2D echo. But sometimes the plaque rupture, you do a stress test, it might be normal today, but tomorrow you can suffer a heart attack because it's a rupture of a small blockage, and that small blockage might not get identified in a stress test. But that does not mean that you should not do a stress test. You're still trying to figure out what your current status is, and you might be able to identify that probably you are having blockages which are creating a mismatch in the demand and the supply, and you can take precautionary measures and set yourself certain limitations so that you don't suffer sudden problem.
Good, doctor. That clearly clarifies, and in terms of the percentage of this happening, uh, how big or how minute is the risk? I mean, if one looks at, say, uh, the death happening without proper testing versus the benefits that will happen. So, how does the cost and benefit balance? I mean, what is your view on that?
So definitely
Should one say, "Jo bhi hoega, let me be healthy till
at the
whenever,"
end
or
of
should
at
one
the
say, "No, no, no, I cannot take any risk. Let me sit at home and become unhealthy and die because of obesity or whatever."
no,
How
so
how
I
does the balance work out medically?
correct, correct. So I would not really consider this as a deterrent to not exercising. Okay, so basically, just because people are having this sudden cardiac death, but again, if you were to see the number of people really suffering from this cardiac deaths out of all the runners who are running in that particular event, the number will still be very, very small, as opposed to people who are suffering from a heart attack because of a sedentary lifestyle or because of many of these risk factors. That number will still be very, very large. Okay, so definitely the conclusion is very strong that exercise is important, exercise is beneficial, and if you're doing exercise in a measured way and trying to progress in a measured way, you can reach any limit. Okay, so you don't have to really again, that also depends on your passion, on your interest and what you want to achieve. But just because I have been through a bypass or I have been through an angioplasty or had a heart problem does not mean that you should be satisfied with a sub level amount of activity just to stay and not increase your risk. There is nothing like that. Okay, by exercising more and more, by trying to improve your amount and intensity of exercise, you are making your heart more and more fitter and healthier only. It's just that you need to do it in a measured way. Don't try to be over ambitious and try to push things very fast. Okay, that is something which has to be avoided. But if you're doing things in a measured way, you can think of doing any amount and any intensity of exercise. At the end, we should understand your heart is a muscle. So if you're making your heart get used to a certain amount of exercise, it is getting adapted to that effort. So frankly speaking, if I keep on doing the same activity for years together, my heart has already got used to that exercise. Okay, so frankly speaking, the optimal benefit now from that activity will be much less for that already fitter heart. So you should always think of trying to increase your intensity and amount of exercise whichever way possible in small increment, so that you are putting that slight extra effort on the heart by which your heart will actually improve. Okay, rather than thinking of doing the same thing. So frankly speaking, people who have been walking that same distance for the last 20 years, that same Marine Drive ka one end to the other end for 40 minutes, okay, are so used to it that they can do that walk effortlessly. And frankly speaking, actually they are doing physical activity. Now they are not doing exercise. So there is a difference between doing exercise and being physically active. Okay, so when I say exercise, exercise is something which will give you a benefit out of it, which is done in a certain regimental way. And if I'm doing that same thing again and again for many years, now I am so used to it, there is no benefit actually coming out of it. Right? So you need to do something which is somewhat hard. So we have an RPE scale that we educate our clients on and patients also. That always try to do something where you feel you're putting some effort. Then that is good for you. If you are doing anything which is very comfortable for you, it is good, but it is not giving you any benefit. Okay, and that is what is the difference between doing physical activity and exercise. You understand? So we might say you should do 10,000 steps in a day. That is your physical activity. You might do those 10,000 steps by walking very slowly also, fast also. There is no measure in that. But as opposed to that, when I'm doing 30 minutes of brisk walking at an intensity which I feel is somewhat hard for me, then I'm doing exercise. Okay, so you cannot really replace that exercise by doing only physical activity. You understand? All right, so we need to have a balance of both. We need to do regimental exercise where I'm putting some extra effort, where I'm feeling that effort, I'm doing something which is somewhat hard, and at the same time try to be physically active in the whole day, which is also very important.
Good. So thank you, doctor. We'll take some questions and I'll just go in the sequential order in which they have come.
Yeah.
There is a question that is, from Ganesh Murthy from Tirupur, and
Hmm.
he says, how many kilometers can we run per day? Pace and heartbeat. Little bit of a training kind of thing, but yeah, but the pace and the heartbeat part, you can definitely, guide him.
Again, I would say it would all depend on that person's capacity at that point of time. All right, and again, so pace is something which would mean at what intensity would you try to run at, and again that would depend on what is your heart rate response. So we would give a certain target heart rate for people to follow depending on your current fitness levels, and we'll see how we can stay in that target heart rate, and depending on that your pace would be decided. So frankly speaking, I cannot really generalize it for everyone. It would all depend on an individualized basis depending on your current fitness status. That's how it would be. I mean, if you want to add anything from your side, Venkat, you being a regular runner.
I would always say that one must start slow.
Hmm.
He's talking about pace and heartbeat, and there's a subsequent question he has asked: what is the heartbeat? I mean, I'm assuming range of heartbeat. So I would always say that one must start slow. When one is a sedentary individual, the resting heart rate will be about 70, 80. Take it to 90, 100 for some time, then take it to 100, 110 for some time, and keep monitoring for symptoms. Take it to 110, 120, then 120, 130. And every week, slowly increase, do 3 or 4 sessions at that heart rate. That can be then the pace will be a natural outcome of that heart rate.
Exactly. Exactly. So basically, as I'm saying, as I said also, that I can give you the target heart rate, which would only depend on what is your current level of fitness.
Correct,
Right.
correct.
So we give you a certain percentage of your maximal capacity, which
Hmm.
would be at a lower percentage if you are a low fit person, and that percentage can go on increasing as your fitness levels go on increasing, and that's how your
Hmm.
pace will improve, your running speed will improve, your effort tolerance will improve.
Correct. Suresh Jadye has asked a question concerned about sudden cardiac arrest deaths in athletes. I think we kind of answered that and we went into that in good detail. Okay.
Yes.
Um, how to determine, he says, there's a follow up question. How to determine accurate maximum heart rate of an individual instead of using 220 minus age formula?
So there is a so physiologically we say your maximum heart rate would be the point where your heart rate stops increasing in
Hmm.
spite of an increase in your effort level or your
Hmm.
work, you know.
Hmm.
And this point can be slightly different from what we calculate using the formula 220 minus age. So
Hmm.
normally we say that there can be a plus or minus 10 to 12 beats difference that can be there as compared to the formula based max heart rate.
Hmm.
So if I want to really measure that, that's what your question is. I will have to do your VO2 max testing, and I will have to put you through a certain protocol whereby I can take you to your maximal exertion
Hmm.
and find out what would be your maximal heart rate. That
Hmm.
is the way of. So there is a testing which we can do, okay, as opposed to just doing a formula based calculation.
Hmm.
So we do those testings at our place. Okay, we do your VO2 max testing, and from that we can find out what is your max heart rate.
There's another follow-up question from him. What should be the frequency of the heart testing for athletes, and is treadmill test enough instead of stress 2D echo?
See, stress 2D echo, what Mr. Venkat mentioned, is something we would strongly recommend for people who are having a known history of heart disease.
Hmm.
Okay, whereby I mean, that's a little more informative than doing the stress test and the 2D echo separately. All right, but for people who are just simple runners and no history of heart disease in the past, you can just do a simple stress test and a 2D echo separately. All right, and depending on the test results, okay, as I said, probably once a year or once in 2 years at least you should do, because at the end your age is increasing. 2 years from today 50 age you reach 58, then obviously the risk is also increasing. So the regularity should be maintained, okay, irrespective of how normal the test is.
Okay. Question from Prakash. Facing issues in post long run after 4 hours, recovery heart rate is still 70 to 80. Is it normal? I think
Sorry,
that
say
there
the
is this
question again.
epoch kicking in. Hmm? Hello.
Say the action. Facing issues in post long run
Long
after
run
four
after
hours
4 hours, recovery
Ah,
heart rate is still 70, 80. Is it normal?
see, recovery heart rate 70 80. I mean, 70 80 is considered to be a normal heart rate. Anything between 60 and 100 is normal. But obviously, if you're comparing it to what your actual resting heart rate is, I don't know what is your actual resting heart rate. Okay, so obviously facing recovery after a post long run would also depend how your system is really adapting to that long run. Okay, now if you think that the recovery is taking too long, probably you should think of reducing your long run a little bit in terms of the timing. Allow your system to really adapt to 3 hours instead of 4 hours, or to a 2 hour run instead of a 3 hour run. So at times your body will give you indicators that this is something which you are not really still capable of, and try doing something which is less intense than what you're doing because you're taking a long time to recover. Okay? But otherwise recovery heart rate is 70 80 is fine. I would say that's still normal. It's not a bad thing.
And some epoch exercise post exercise, oxygen consumption is going to kick in. So I think it would be normal. One shouldn't even be bothered about it. I wouldn't look at it as an issue. Okay.
Correct.
Jacinto is asking this question. I have friends and family members with high BP issues. I have
Hmm.
been coaxing them to start exercising with walking, slow jogging, etc. But they are adamant that their condition will worsen. Okay. They should actually be, seeing the recording, Jacinta, and Jacinto, sorry, and we will do the show notes. And when this question is being asked, you can jump to that section of the video in the show notes. You can see all our other show notes on the channel, and Dr. Kiran Sangani just clarified that exercising is good for cardiovascular diseases because especially it makes the blood vessels larger and also flexible. That is what you should tell them. Sorry, I'm replying on your behalf, Dr. Kiran.
Yeah,
the
yeah,
the
absolutely,
channel
no problem.
response is, "अरे नहीं BP का problem है. Is it safe for high BP patients to start exercising?" Okay, so this is the question that I'm leaving to you.
So definitely exercise is important for all these people who are having any type of high BP issues, and we need to make them understand that in fact exercise will help to reduce their blood pressure. And as I explained earlier also, physiologically by exercise our blood vessels will dilate and the blood flow will become much more better. So eventually it actually reduces the resistance to our blood flow, and my heart also has to apply less force to pump the same amount of blood, and that is what is the basis behind how their blood pressure will reduce by doing regular exercise. So in fact by doing exercise their dependency on BP medications can reduce. Okay, so it is really very important for them to start exercising no matter in what lower intensity, but they can gradually build upon it, so definitely, I mean, they can consult a doctor, and that obviously many a times advices coming from professionals would be much more taken or acceptable by the community as opposed to friends and relatives, so your family and friends advices never really work, okay, as opposed to a professional. Frankly speaking, my advice to my family members also does not work. So so
घर
it's
का
always
मुर्गी डाल
important
बराबर
to
kind of thing.
exactly, so it's important that they take advice from a professional, and that is something probably which can help them to change their behavioral pattern and accept exercise as a medicine for their high blood pressure.
Very good. Question from Prashant Kothari from Jalgaon. Actually, no physician have told me to run, saying that why do you want to do it? Do little exercise and walk in the morning and evening. It's a very typical thing that we see. As said by Venkatraman continues, majority of physicians do not do exercises, which is very unfortunate because the person who's supposed to be the primary health giver himself is
Yes,
not healthy. How can he make others healthy?
but I do exercise.
Thank you very much. Yeah. But I never seen you run even a 10K.
No, no, but I am fond of cycling and the other exercises. So I
Okay,
am
very
not
good.
really into running. I do make the patients run, but I prefer cycling.
Okay.
Mm.
There is a question from Sagar, and he says
Mm.
any checklist of tests that one should take before long distance run or any new exercise. I mean, it's a little bit general, but I leave it to you.
But I would say as a general health checkup, okay,
Hmm.
something which everyone I would say above the age of 40, irrespective of whether you are planning to start exercising or not, is to get your sugars checked. Okay, once in 6 months at least get your blood pressure checked by your physician. Okay, so blood test would include doing your sugar and cholesterol, and from heart related tests doing a stress test and a 2D echo is something which you can have as a checklist to do before taking any long distance run.
Okay. That's this. One cannot have a checklist of a test that one should do before every long distance run or every new exercise. But
Not
one can
every.
have one can have some. I mean, there's no kicking of the tires every day in the morning. But yeah, once in 3 months, once in 6 months, depending upon how your parameters are tested before,
Correct.
would be the correct way
Correct.
to. Kranti is asking a question. Thank you, Kranti, for coming on the show. If a person who has been a regular gym strength training for long, but never run before and takes up running, should he take a test?
Should we take a test?
So
Uh,
I'm assuming strength training without any cardio in the gym.
Correct. So you can take a test. See, definitely you need to understand that as you you are a regular exerciser doing strength training regularly, means you are passionate about exercise and you do strongly believe exercise is good for you. You need to also understand, as we take exercise and nutrition as a part of a good lifestyle, we need to understand even regular checkup, preventive health checkup is also a part of a good lifestyle. Okay, so irrespective of what you have been doing regularly in your exercise routine, it's always good to do a checkup to find out what is your current medical status or health status. As I said, many of the parameters are silent parameters. Okay, so there is no harm in doing a stress test or a 2D echo if you intend to plan to run. And obviously, because you're not used to doing any type of cardiovascular exercise and suddenly intend to do a vigorous cardiovascular exercise, it would be advisable to do these tests, okay, to know your current status.
Good.
But not like a mandatory thing. Now that would also depend what your current age is. We don't know really your entire background. I'm just giving you a very generalized answer. I would need to see how so your age would be a very big factor.
Good. Prashant Kothari is asking a question, not really of the heart, but more about the knees, which for many runners is close to the heart. Okay. So how does one, what is the test required for the knees and how to evaluate? I mean, are there any general guidelines for knee health?
I would not say any regular test you need to do for a knee checkup, as long as you're not having any complaints related to your knee joint and not complaining of any pain or difficulty in climbing or climbing downstairs or up. Okay, as such, not any specific test required. At the most, what you can do is, because of your age factor, if at all, again, I don't know what your age is, all right, but because of the aging process, people can have initial signs of arthritis or a reduced space in their knee joints, and simple x-ray can give us an information on that, and which can become as a guideline whether you can continue doing running or not, but at the same time, if you are able to run without any difficulty, I don't see any need to really stop doing that. Okay, so running is going to, in fact, there are many studies which nowadays say that running can actually help in preventing knee arthritis also, although being a weight bearing exercise. So as such, no specific test as such required unless you are having a problem. But just to find out your knee condition, a simple X-ray of the knee joints can give you a good information as to what is your knee joint cavity like.
Mayur Nayak says there's a good session. Sajid Lara says thank you, Sajid, thank you, Mayur. Saurabh has another question, and he says mind your body will power helps overcoming the physical challenges. Example, willpower. Okay, this is a full iron triathlon, but how to draw a line where you are able to listen to your body and not to be driven by the willpower.
See, again, you have to listen to your body, no matter how passionate you are and how much willpower you have to push yourself as much as you can. But if your body is giving you warning signs and indicators that it is not able to cope up with the stress that you're putting on it, eventually you are going to become incapable of doing the same thing in future. So rather thinking of a longevity, a healthy longevity, we need to listen to our body.
I
Okay,
agree. So I always like to give the example that what are you running for? If you're an athlete going for a gold medal, or if you're Eliud Kipchoge trying to break the world record, then you got to give all you got, willpower, no willpower, whatever power, you got to go and do it, because there's so much of stakes in that performance of yours.
absolutely,
Yeah.
yes.
Whereas if you're just a recreational athlete doing it for the fun or because you want to tick off a box that you did an Iron Man, I mean, shaving off a few minutes here and there doesn't really matter at all.
Absolutely.
This is
Exactly.
my view.
Yeah, yeah,
That,
very true.
that is.
As I'm saying, you should be able to repeat that same thing after 2 years or 3 years. And if you're
With
looking at
pleasure,
those
with
things,
pleasure. I should be happy doing it.
exactly. And for that, you need to listen to your body. Okay, definitely.
So,
Then those
so, so,
timings and pace will not really matter.
so jokingly, it is said, that Philippines ran from Athens to, marathon to Athens to convey that news. The story of the
Yes, yes.
Greek
Sudden cardiac
athlete.
death.
And then after reaching and giving the message, he died.
Correct.
So he himself was the first in-race casualty.
Correct.
Yet
First sudden cardiac
how
death.
does a marathon start with? with that kind of an incident. So people just say it jokingly as a humor. Anyway,
Yes, yes. So
okay.
you have to listen to your body, no matter how strong
Correct.
willpower you have. Okay.
Correct. So there's a request, Dr. Ravin Kumar. Doctor, your views on HR based running over fast paced running.
I
Very
would
generic,
purely,
but yeah.
yeah, but I think HR based running is very scientific and really tells you how your heart is performing while you're putting that physical exertion. Basically, it is your heart's physiological response to the physical effort that you're putting in. So you need to really follow the HR based running to know what your limitations are, okay, and not really try to create a mismatch between the demand and the supply. So I would strongly prefer to go with the HR based running rather than just fast paced running, where you're trying to push. It might be for a moment or so, then it's okay, but eventually a steady pace running is something which can really help you to control your parameters and accomplish your targets in a much healthier and better way.
Good. Kranti has asked you another question about those runners who suffered cardiomyopathy and who collapsed. So the question is that if they were given CPR, would they have survived?
See, CPR is, so when I said they had this cardiomyopathy and they had a sudden cardiac death, the cause or the event which leads to that death is that irregular rhythm which develops in your heart. Okay, as a precursor to that is the cardiomyopathy, which becomes the base causative factor. But that has led to this irregular rhythm. So when we are saying we want to give CPR to these people who are suffering from these sudden collapsing episodes, the CPR is mainly targeted towards at least maintaining the blood supply to your heart and your brain till medical help arrives. And if at all, I can use the defibrillator, the shock machine, to revert that irregular rhythm which has developed. Okay. If I can revert that rhythm back to a normal rhythm, then I am increasing your chances of survival. So CPR has these two goals. One is to maintain the blood supply to your heart and to your brain and to the other organs, and to trying to revert the rhythm back to a normal sinus.
Good. Uh, yeah, but it's very difficult, that CPR can save, cannot save. I'll
Yeah,
give
I'm
you
not
an
saying it's a
incident.
guaranteed thing. It is increasing
Correct.
your chances. Okay, we are saying increasing your chances of survival. CPR, as soon as it has been given and use of the defibrillator, if possible, you're done, your chances of survival can be better as opposed to people who don't receive the CPR.
So, I will give you an incident. I will not name the year or the city or the event where it happened because that is not relevant. But this runner was picked up about 4 kilometers before, obviously suffering a cardiac incident. Ambulance was immediately came. Ambulance brought him to the base camp. Base camp was very well done, and the doctors immediately started admitting CPR. He survived, and then he was put into the defibrillator, taken in the ambulance, taken into ICU. Because of the CPR in the ambulance, he survived. But the cardiac arrest was so acute that it led to brain damage. He never came out of the coma. And after 1 month or so, he passed away. So, did CPR save him? The answer is CPR saved him. But by then, damage had occurred. So, it's a very difficult
Yeah, yeah. See, I'm
situation.
saying
It
we
varies.
cannot really predict what would be the consequence
Correct.
which will happen.
Correct.
Okay. I mean, that is something which is not in our control and not in the control of the person who is giving the CPR, because he doesn't know exactly how much damage has already happened inside. Okay. But he is doing his best till the actual medical help arrives, so that he can help the heart and brain to receive as much blood supply as possible and try to restore the rhythm of the heart.
Correct.
Okay, so many a times people would come back to absolute normal life.
Hmm.
Sometimes, if not having good luck, then the consequences can be really harsh.
Yeah. So the question is that all runners, and I say this time and again, must learn CPR, and they must be CPR. Trainers must know CPR because they are responsible for the health of the group, and
Every
and
layman,
and CPR
every
can make a
layman should.
difference. Correct, and CPR can make a difference for that person who can say get saved, and for whom it is very life saving. For him, it makes all the difference in the world. The CPR, knowing CPR can give him a fresh lease of life.
Absolutely, absolutely. So it can be really be applicable anywhere. If you
Correct,
know how
anywhere.
to give it, and it's not really that much of a difficult thing to learn.
Correct.
So very important that as much as the general population can learn CPR, we can really reduce risk of deaths due to heart disease.
Mm. There's a question from Anil Panchal, and I think he's your student. Uh, he says, I started running at the age of 59, current age 64. Good, Anil. After my angioplasty, oh wow, okay. He completed 28 half marathons and 2 full marathons and regularly go for my medical test. What extra precautions I need to
Well, nothing. Just look into your diet and check for your parameters regularly, and hope for the best.
take? Yeah, I mean, yeah, if one is checking regularly, then what more can one do? I mean,
Exactly.
also
I mean
there's
that's
also this thing about only so much you can do. Ultimately, somewhere you have to accept also
yes,
fate.
absolutely.
Yeah.
Yes, yes, yes. So you need to continue doing the right things, which is
Correct.
in your hand. Okay.
Correct.
After that, also what happens, I mean, is not in your control.
ऊपर
But
वाले
that
के
does
ऊपर.
not mean that does not mean that you should stop doing the right things.
हाँ,
I also, I mean, this is again an example by Dr. Contractor, and which I also repeat many a time. I've taken it from him. It's about the safe driving and the rash driving.
correct.
So someone who is a rash driver might never suffer an accident, but a safe driver standing at a signal might be, might get an accident. That does not mean that everyone should drive rashly.
Hmm.
Okay, at the end, you need to continue doing the right things.
Hmm.
All right, and if you're doing the right things, definitely your risk of suffering from a disease can be less as compared to people who are not doing the right thing. But at the end, the final result is still not in your hand.
I agree with you. There's a message from Raji Gofit, and I think she's one of our students. Hello, Doc and Venkat sir. Hi, Raji. Durga Upadhyay also says, great session, thank you. There's a question from Dinesh Kumar, which is a little bit interesting. He says, is there any other test other than stress test and 2D echo which shall give more accuracy of the cardiac status or possibility of any alignment in the future?
So I would say one of the tests which Venkat mentioned and which we prescribe to our heart patients to do it before their runs is to do a combination of the stress test and the 2D echo, which is called as the stress echo. Okay. So normally a stress test is where you are going to walk on a treadmill till you reach your maximum heart rate, and the cardiologist will see how your ECG is coming. And in a 2D echo, which is done normally in a resting stage, you are made to lie down and the person will do a sonography of your heart to find out how your heart is functioning at rest. Okay. Now this combination of stress echo is where I'm doing these two things as described, but I also repeat the 2D echo immediately after your stress test, means when you are at your maximum heart rate. So the person is trying to find out how your heart is contracting while you are at your max heart rate. So we are trying to find out, is there any abnormality in the contraction function of your heart, which is also a muscle. Okay, it might be receiving, the ECG might show normal because the blood supply is enough, but probably the contractility might not be enough. And that might be an indicator that at that peak exertion, your heart is not able to contract efficiently, and probably you should not be reaching to those high heart rate levels and can be restricting yourself to a little lower levels, to avoid any mismatch again in that contractility of the heart and your demand. So your stress echo, or there is another test called as the thallium stress test, which is on the similar lines of a stress echo, but instead of the 2D echo, they would inject a thallium dye into your system, and they would see how much of that dye is getting absorbed by your heart muscle while you are at that peak exertion. So the more the absorption of the dye by the heart muscle, means that much more of the heart muscle is functioning even at that exertion, peak exertion. So these two tests, which is a stress echo and or a thallium stress test, are more advanced functional tests to find out about your heart's functional status at peak exertion. Otherwise, then there are direct anatomical tests, which is either doing a CT angiography or an angiography, which I would not really suggest unless indicated.
Good. Amit Yadav, hi Amit, good evening. There are no annual medical checkups this year in corporate houses. Okay. Hundreds of employees have suffered from COVID 19 and recovered by God's grace. Even at this stage, there are no signs of any AMC. Any guess how much can be the impact on general health as symptoms are normal to extreme in certain cases? So the question is that post COVID, what is the impact of COVID on exercise physiology?
So definitely now a lot of this data still COVID is something which is not fully been studied yet, and day after day we are getting new information, especially on the medical side. And nowadays a lot of this data coming up on long COVID, which is basically people are suffering from delayed complications even after turning COVID negative, So people are having effects on the heart, effects on the brain, effects on the kidney. Recently there was an article whereby I think from KEM hospital or somewhere, where many of the COVID cases who are having borderline creatine levels, okay, post COVID, everyone is on a permanent dialysis.
Oh,
Okay,
okay.
so it has got effects on kidney function as well. So
Hmm.
many of these delayed complications are nowadays developing due to COVID. It's not something which is happening to each and every person, but that's where even if you are having very mild symptoms related to the COVID, it's important that you can get yourself evaluated even after a month or 2 months post COVID and see what your basic parameters are like, something like your lipid profile, your kidney function, liver function, and even doing a heart related test, just to see if all these parameters are under normal levels or not, and just to rule out any delayed effects of the past COVID on these parameters. So we need to be aware of these delayed complications, and strongly recommend people who are having any history of COVID or currently suffering from COVID to get enrolled in any of the COVID rehab programs which are conducted. Okay, and these are all online programs nowadays. We also conduct the COVID rehab program. So definitely the focus is on how we can optimize your health and try to prevent any of those delayed complications from developing. The most common being a very viral fatigue, post viral fatigue, which is very common and which can stay for as long as even 2-3 months post turning negative also. So that's where exercise will play a very big role in helping these people to optimize their health. But again, supervision is required. We need to monitor your parameters very efficiently and strongly recommend to do it in a supervised way.
Good. Ganesh Murthy says, thank you. Jacinto, thank you very much. Thanks for this. Ganesh Murthy has another question. He says, I've left ventricular hypertrophy. It's okay. I'm running 10 kilometers per day.
Yeah, so that can be really confused at times with people when I say the hypertrophic cardiomyopathy.
Hmm.
However, the biggest difference is that when people are regularly exercising, they tend to develop a little left ventricular hypertrophy. Why? Because the left ventricle is your main pumping chamber. Okay, when you are exercising. So, as I said, your heart is also a muscle. And like any other muscle in our body, if I'm lifting weight, my muscle size can increase.
Hmm.
And the same thing happens to your left ventricle if you are a regular exerciser.
Hmm.
So quite commonly athletes would have this left ventricular hypertrophy, and that is something which is a very normal finding, and it's not really going to create any impact on your health status. It's very different from the hypertrophic cardiomyopathy which I mentioned,
Hmm.
whereby the heart muscle does get thickened, the walls between the two chambers do get thickened, but your heart capacity remains the same. So the volume of blood which your heart can pump out is still the same. It does not increase. Whereas with a regular exerciser, your hypertrophy is happening, but your volume of the heart is also increasing. So the blood coming out from your heart is increasing, which is in a proportional way, as opposed to a hypertrophic cardiomyopathy, which is not proportional.
Good. So basically, the cardiac output is more efficient in a way.
Exactly.
Correct.
In a regular
Thank you.
exercise.
Sagar Khedekar, says his thanks. There's a question from Paras Kumar, which is a little bit of a medical thing, but I'll leave it to you whether you want to answer. I'm taking 20 mg on BP. Is it possible to reduce as I run and cycle daily and also reduce weight up to 74 kgs? How do I do now? Okay. And there's a follow-up question. I'm taking 125 mg on thyroid, but not getting good TSH. The thyroid question will leave out of the way because that is absolutely out of the this. But is it possible to reduce BP medication since he's exercising regularly?
Yeah, so definitely it is possible to reduce a BP medication, but I would not do it unless I have measured your BP. So you need to get your blood pressure checked by your physician, see what are the current levels, and then as per his advice, you all can decide whether the BP medication can be reduced, and then again a monitoring would be required to see after reducing the dosage, is your BP remaining at the lower level or not. So even if we are able to reduce the dosages, that does not mean that you stop monitoring yourself. Your monitoring would still be required. At times after reducing the medicine, the parameters might again increase. Okay, so it always has to be balanced out. So even if I have to reduce anything, I need to constantly supervise it after reducing, see if my parameters are maintained, then I can stay with that level of dosage. If not, then I will have to go back to the earlier dosage. But yes, dosages can be reduced. Exercise can help to reduce your dependency on medications.
Good. There's a message from Shekhar Kulkarni. He's a very regular runner. Just saying good evening. Thank you. Very informative. Prashant Kothari, very clear view. Saurabh Jadye, thank you, sir. Excellent session. Prashant Kothari is talking of coming and getting the VO2 max test done sometime when he comes to Bombay next. I don't know if he's still in Bombay. Vaiju is saying, good, great going. Thank you, Vaiju. He is from Nagpur. Anil Panchal, thank you. Uh, Thank you. Amit Yadav, I read an article on patients with GBS history and post impact of COVID 19 relapse, again suffering from GBS. Also, 24 deaths in Mumbai itself. Very scary as I have suffered from both. Is there any correlation between GBS and COVID? I mean, what does the literature say on that?
So there has been a recent study, or not study, study still not out. The
Hmm.
many of the COVID task force, few of the doctors, neurologists from Global Hospital in Parel and other doctors elsewhere are doing this study where they have found many cases, not many, but they have found these 24 cases who suffer from this Guillain-Barré syndrome. Okay,
Hmm.
so Guillain-Barré syndrome is basically a neurological disorder which can lead to a paralysis of all your four limbs.
Hmm. Hmm.
Okay. Now, frankly speaking, they still have not developed a correlation of COVID to that GPS. Okay, they found the GPS in people who had the COVID in the past. Now they need to study those people and find out is there any correlation. So it is something very similar to the delayed complications which I have mentioned earlier. So the COVID still is a little ever evolving situation or a topic whereby we still don't have clear information on how that disease is progressing, even after turning negative, what all things can happen to a person, what precautionary tests we can do to find out. So this is something where we need to still keep on reading about it. But with you, as you're saying, you already had COVID, I guess you said you had COVID, I guess.
Yes, he had COVID.
So if you had COVID in the past, it would be a good practice if you can get yourself tested for certain basic blood parameters, let's say every once in 2 months or something, till you are completely, let's say 6, 7 months down the line. Now their chances of any delayed complications are completely out of question. Okay,
Very good.
so that's how you can do. Otherwise, it's
Hmm.
very unpredictable.
Hmm. The question from Nirpen Chaudhary. I am 69, can run 5 kilometer up to 10 kilometer at 55 heart, minute BPM. Run 5 days a week, totaling about 180 k a month. Should I do any test to assess my heart's condition, and what are they? Obviously, he's a
I think
regular runner. He's doing good mileage. Yeah.
yeah. But if you have not done any test in the past or in the recent past, I would still strongly recommend you should do a 2D echo and a stress test once a year, especially with your age of 69. Okay, I would strongly recommend that. And it would be important to find, I mean, it would be in all probability we would say that you're a regular exerciser, your heart should be healthy, but we should not be in that blind belief also. So it's very important to get yourself evaluated irrespective of how good exercises you might be doing.
Correct. I would also kind of second that. Okay. By the way, Kotari, very informative session. Kranti has one more question. My resting heart rate reduced to 34 during the training. Can this low rate affect blood circulation at rest?
Not really. Your resting heart rate reducing to 34 purely because of your excellent fitness levels, which I would presume, okay, since you are a regular exerciser, in
Hmm.
all probability means that your heart is strong enough
Hmm.
to meet the demand of your resting body by
Hmm.
working for only 34 times in a minute.
Hmm. Hmm.
Okay, that is what is the basic understanding. When we say my heart rate has reduced, means my heart muscle has become that much more stronger. Unless you say that I am not a regular exerciser and my heart rate has reduced so much, then I would have doubts in my mind and I would try to do some heart related investigation, especially an ECG, to find out if the conduction of my heart rhythm is normal or not. Okay, but otherwise, if it's purely as a result of good amount of training, it's quite common for very fit athletes, to have heart rates of 35, 40, 45 resting heart rates.
Good. Mittal says thank you. Baiju from Nagpur has a question whether it is advisable to run by CKD patients or not.
Yes, why not? So, in fact, chronic kidney disease, oh yeah, cancer patient or a heart patient, we would say the maximum stress on your body by doing any physical exertional activity comes mainly on the heart.
Hmm.
So if we can say a heart patient can do anything, definitely a chronic kidney disease patient or a liver disease patient or even a cancer patient, everyone can do. It all depends on how you are training. Okay, it all depends on what is your current status and how we can train you to reach a good level. Okay, so if the question is simply can I run or not, yes, you can run. Okay, but how to make you reach that level of activity depends on what is your current status and by proper supervision.
Thank you. Anil Panchal has another question. What is the difference between thallium and angiography? I do thallium test once in 2 years at Reliance Foundation Hospital.
Correct. Angiography is like a direct anatomical investigation of your coronary arteries.
Hmm.
Okay, where we would inject a dye into your blood supply, and on the screen we would see how that blood is passing with that dye injected. So now I can see that vessel clearly. So the cardiologist would try to see all your coronary arteries on the screen, and obviously if there is any obstruction to the flow of the blood, it would be clearly evident on that screen. Okay, so that's the difference between, whereas thallium is more of a functional test. Okay, it tells me how my myocardium is contracting when I am at full exertion. Whereas angiography is done in a resting state by giving you some anesthesia, local anesthesia, and we try to find out your coronary artery blood circulation.
Good. Dinesh Kumar says my resting heart rate. Last question. My resting heart rate is an average of 40 to 45 per Garmin. On sleep, on average, it is 34 to 36. This is okay.
Absolutely, it's okay. Yes,
This is
I
okay.
think we just answered that some time back.
Yeah, correct. MP Jain from Delhi. I joined late, still find the discussion quite useful. Thank you, MP Jain, for joining. Kranti Salvi says thanks. Amit Yadav says thanks. Baiju says thanks. I think we're done with all the questions, doctor. And is there any last words you want to say before we kind of wind up this session?
I guess, as I said in one of the slide, age is never a bar for any amount of exercise. Okay. At the same time, exercise is like your medicine. So no matter what type of health issue you might be suffering from, you will definitely have to exercise, provided you get the correct guidelines as to what is the correct amount of exercise as per your current health status and fitness status. Then definitely exercise is very, very beneficial. Okay, so you need to uh, as I said, you need to make exercise as a part of your daily routine, and be very regimental about it. Definitely it is going to have huge effects on your overall health status and your fitness status, and has a big impact on your overall quality of life. Okay, so no matter what type of health issue, your quality of life will definitely get better at no matter what age you start. Okay, so many of the time, many of our cardiac patients get enrolled with us even at the age of 70, 75. And prior to that, they have never exercised. But suddenly from that 75 till the age of, so I can have an example where someone joined me for cardiac rehab at the age of 78 when I started practicing in 2004 at Kambala Hill Hospital. And today, after 18 years, so now he's 96, he still comes for cardiac rehab. And this age of 96, he has got 5 stents in his heart, okay, but he's still able to walk at a speed of 6 kilometers per hour. He does the cross trainer for 15 minutes. He lifts weights. He attends his office regularly. Absolutely fit person at 96. So age
Fantastic.
is not no bar.
Fantastic, doctor. Fantastic. A very good example. And I thank you very much for taking the time out. Sorry, we went far beyond our usual time, but it is
That's
one of
okay.
the practices of this that we answer all questions, because people don't ask questions and they don't get doctors easily available. And sometimes the question doesn't occur to you sometimes when you're in front of a doctor. So in the conversation, whatever questions come, we try to answer all of them, even if it takes a little bit longer than our normal slot of about 1 hour. We try to keep everything 1 hour, but the questions can go a little bit longer.
Yeah, yeah, but that's okay.
So,
No problem.
so thank you very much. Thank you, everybody. Have a nice evening. And just to let everybody know, we'll be, of course, recording it, and then there'll be show notes. So, whatever references were made by Dr. Sangani, in terms of this, even your slides, they can be part of the show notes if you can share them with us. And
I'll
also
share.
the link where you talked about the exercise routine that you have given for people at home. So, people, if they are interested, they can go and do
I'll
that
share
exercise.
the YouTube link. Yes, yes.
Please send that, and we'll make show notes, and then it is always circulated again. Always useful to have this kind of material. Thank you very much. Good night, everybody. Thanks a lot. Have a
Bye.
nice week.
Thank you for having me. Thank you very
Bye.
much.